when you shake with a chill, not just a regular chill. There are muscle aches, there are headaches, sore throat. But I think probably the most important thing, and we'll talk about how to interpret these symptoms soon, is you can't smell or taste properly. So yeah, so those are the new ones that the CDC has listed.
All right, but I want to ask you, I mean, granted, that's been observed in some patients who have COVID-19. Aren't those more commonly attributed to just the flu or the cold? So how worried should people be, right, if they spot that in themselves?
I think I was worried when I looked at these symptoms because I think it may lead to people being unnecessarily scared or concerned. So I think what we could talk about, or the way I look at these, is really what's the most important thing that people are listing. And the most important thing is still really the original symptoms that the CDC reported, which is fever. That's like super common in COVID. And then, you have a cough and then you can't breathe properly. Mm-hmm. Those are the three. And then of the ones that they listed, the 6 ones, probably the most important ones is you can't smell and you can't taste.
Okay.
So one of my colleagues actually put all of these together really well in a super easy to use guide, mm-hmm. which is you wake up in the morning, you check yourself for fever, and mm-hmm. you smell your coffee. If you don't have your fever and you can still smell your coffee, you're pretty much good to go.
Okay, that's a great rule of thumb. Thank you for sharing that. I also want to ask you about COVID toes. Over the weekend, I started to see some pictures of people with toe rashes. Talk about how common that is.
Yeah, so it has a medical term. It's called purgio. It's not something we normally see in medicine, but people have been reporting it more with COVID-19. The interesting thing is it probably isn't effect necessarily of an active infection. We don't really know too much about it, but it may be an immune reaction or immune complex reaction to a virus the body has seen. Actually, at UCSF, in pediatrics, many adults, when they tested the young people who've had this redness of the toes, they didn't find any active infection, which made me wonder. And sometimes in infectious disease, we see a reaction in the body, on the skin particularly, after the virus has already come and gone. So whether or not that is one of these complications is the way I would think about that, Nicholas. So notice the CDC didn't list that because it probably isn't something that's one of the active symptoms of COVID.
Got it. Could very well be that you had it, you got over it, but we probably need more cases and more data to be able to tell for sure.
We need more information, and again, a little bit more in kids rather than in adults.
Okay. Now I want to switch to the topic of the shelter in place, which, as you know, the 6 main Bay Area counties, along with the city of Berkeley, have gotten together, and the public health officers decided to extend the shelter in place and social distancing through May, all of May. So this comes at a time when a lot of people were starting to say, hey, we can't take it anymore. You can see evidence of that. People, going to the beaches, packing the parks. So can you talk about whether the numbers support the need to continue these types of actions? Because a lot of people think, oh, hospitalization steady, ICU steady, rate of climb steady. So what's going on?
Yeah, so I know it's really, really tough. I mean, it's tough for me too. I mean, I kind of joked about not being able to get a haircut early on because I think these shelter-in-place policies is affecting all of us. But I really think, first of all, I'll make a general comment and I'll comment specifically on how I think about where we are in the epidemic in California right now. My general comment is, so far, I've kind of trusted our leaders because it's really well informed by public health experts as to what to do. They've really made a really fortuitous and wise decision early on. And I think it's up to all of us, myself included, to believe them when they don't think we're ready yet to proceed on with easing restrictions. And then specifically, I think one of the things that we need to really ease restrictions is a better barometer. And we've talked about this on this program before, of how we're doing in the community. And we're ramping up testing still, and that's one strategy. The other strategy that I think we've mentioned is that whole idea of contact tracing. So you need to have, even if you don't have enough tests, you definitely need to have a workforce that's ready to go out there when there's a case and interview all the people around that case, and you contain the infection. Once you have the workforce to do that, a little bit more testing, you can like really ease restrictions, because then you can say, well, now our cases are going up because we have a more sensitive barometer, or now our cases are going down. So we could even, reduce restrictions a little bit more. Remember, as Governor Newsom said, it's about dimming the switch. So it's not like turning the light on. So I think using that barometer is really helping you adjust the volume on your stereo.
All right, that is definitely a good way to think of it, as a dimmer. And as the 6 county public health officers noted, that in the coming weeks, we'll likely see some easing up. The lower risk activities may be able to resume. So that's exactly what you're talking about. Okay, I want to get to some Facebook questions from our viewers. From Lisa, she wants to know, can someone get reinfected with COVID-19?
Yeah, so that's been a topic of interest, and I think really heating up in the last week or so, because the WHO, of course, had tweeted this story, and then they kind of like moderated a little bit. The first tweet was about not guaranteeing that everyone would have immunity, and then saying, again, clarifying it, that, a lot of people would have immunity. And so my thought about reinfection is that it depends on if you get these antibodies, these good antibodies or not. Not everybody is probably going to get good antibodies, because we know when people get colds, for example, when we check their antibodies response, not everybody, actually most people don't get antibodies from a cold because your body isn't angry enough. It's not usually a really super sick, and you don't get super sick from a cold. You might feel crappy, but it doesn't affect your lungs or your heart or anything. So the antibody response isn't very robust. It seems interesting that with COVID, that probably the people who get sicker would probably develop more antibodies. But of course, that's just our guess right now. We're still, need some more data to look at that. So meaning that if you were one of those people who just had very mild symptoms, you didn't develop antibodies, you may be able to get it again in the next season. And I think that's why we can't really reduce these restrictions or feel home free, because until we have a vaccine, not everybody will get that antibody response, even if you had it.
Ah, okay, that makes a lot of sense. So the harder it hits you, the harder your body fights back, and those antibodies, that's what's going to protect you. Okay.
And that's what the vaccine is. Vaccine is like getting around that by tricking the body into thinking that it's getting like super invasive infection.
Okay. Oscar is asking, I'm planning to drive and move in with my girlfriend and her family in Texas. What do I need to do in that process to be as safe as possible?
Yeah, I think, one of the interesting things is driving. I think driving is okay if you're not driving with a lot of strangers. Again, it's all about the basic principles of social distancing. Or if you're driving, drive with family members who you've been living with for a while. So it's not something, if you're driving with strangers, of course you want, although it seems could be uncomfortable, again, try to sit as far apart. Maybe you have a Volkswagen Bug, one of these big trucks or something, and you can like sit 6 feet apart. But again, if you're driving by yourself, I think that's one of the factors that people say distinguish California from New York, is that most people in California have a car. We're kind of like in our own bubble, whereas in New York, everyone takes public transportation. So it kind of spread like wildfire. So I think it's okay. Now, when you get to Texas, that's a different story.
Yeah.
I mean, I feel like unlike California, the epidemic in Texas hasn't necessarily matured yet. And with them possibly decreasing restrictions, you may have a little bit more disease in that community. So as a Californian, you would probably be more as educated as the best in the country as to what to do to keep yourself safe.
Okay, good advice. Thank you so much. Let's take a short break on air, but continue the conversation on our live streams right now. So you can join us there if you like, but we'll be back on air in a couple minutes. All right, in commercial break with our friends on Facebook, and back with UCSF infectious disease specialist Dr. Peter Chin Hong, a frequent guest because he's got a lot of great information. When we come back on air, I do want to talk about the plasma transfusion that's now happening at UCSF. But let me get to a couple of other Facebook questions while we're at it. Somebody wants to know whether COVID-19 is causing stroke and heart attacks.
Yeah, those are great questions. Those are really, really sophisticated questions because they are kind of at the cusp of medicine right now. First of all, the heart complications from COVID was seen probably not so much in the Chinese data, but once it started going to Europe and then to even Washington State. So the nursing home that was the hospital right next to the nursing home in that Kirkland nursing home outbreak in Washington State saw a lot of heart conditions from the COVID patients. So they included the heart not pumping as well, people with heart attacks, and basically clots in the heart. And the reason for the heart is that the receptor, meaning the place where the COVID-19 virus, SARS-CoV-2, lands, is not only on the lung, but the landing pad or the landing site for COVID-19 is also located on the heart. So people think that that co-location is responsible for heart conditions. But again, the second point you brought up was like extremely current, which is, are COVID patients clotting more than non-COVID patients? Mm-hmm. And I think the answer is probably yes, but we need more information.
Okay. All right, Peter, thank you so much. We're coming back on air in 10 seconds. So let us go ahead and get ready to come back on air.
7, 6, 5, 4, 3.
All right, and we're back on air with UCSF infectious disease specialist, Dr. Peter Chin Hong. Dr. Chin Hong, one of the things that you've been really busy with this weekend is on Friday, UCSF successfully did a transfusion of convalescent plasma from someone who recovered from COVID into a really sick patient. Can you talk to us about that process and if it's showing signs of, being successful so far?
Yeah, so Kristen, that was a really remarkable thing that happened in the Bay Area on Friday night, and it took us all by surprise. Not because, it was something unusual, but I guess it was unusual with COVID-19 because we haven't done too many of those in the country, and certainly not in the Bay Area. And mainly because it happened out of the blue, like many of these things that seem almost miraculous do. So we had been preparing the system for about 3 weeks or more to accept these donors who were recovered from COVID-19. They have the antibodies or the good army against COVID-19. And the idea is that you want to put that army or fighting soldiers into people who are super sick and haven't developed those antibodies or that army yet. So the idea is that, and we have been doing that in infectious diseases since polio, actually. So polio, SARS, MERS, even hepatitis A before you went to Asia. You might have remembered before the vaccine, people got IVIG as a shot. So it gave you antibodies so that when you went to that street vendor, you were protected from getting hepatitis A. So it's the same idea. It's been long and used a lot. But in COVID-19, we haven't done it too much in the United States, but the FDA was so encouraging that they gave the Mayo Clinic a sort of blanket license for many people to do it legally.
Yeah, I mean, in fact, we reported on actor Tom Hanks, who has recovered, and his wife, and they're donating their plasma. So basically, are blood banks pretty much saying, come on in, donate, we'll collect it and send it off for this purpose? Yes? Okay.
Blood banks are ready.
Okay.
I mean, you have to be, I think the easiest is if you have evidence that you actually had COVID-19 from a test result, you can ask your doctor for that. And you have 28 days of no symptoms. You can go to Vitalant on Masonic in San Francisco or any American Red Cross, and they'll take you.
Okay, what if you're like my friend? She thinks she had COVID, but she never got tested.
Yeah.
So what should she do?
If you think you have COVID, but you didn't get a test, there's actually now a way you can do that, which is to ask your primary care physician or provider to order you a good antibody test. So the blood banks will accept an antibody test from a good company. Well, you can talk to your doctor about how confident they feel about their particular antibody test they're offering. If you have a positive antibody test and 28 days of no symptoms, the blood banks will also accept you. I will also say if they don't, because they're going to do a lot of back testing after you donate, if they don't use it for COVID-19 and if it doesn't have the antibodies, they'll probably use it for somebody else who's not COVID-19 because these are universal products that are used.
Got it. So this patient that received the transfusion, have you seen an improvement yet, or is it too soon to tell?
Yeah, so it's tough to say at this point because so many things are going on. So I think we're just sitting tight and waiting and hoping.
Okay. Here's a great question coming in on Facebook. With this type of plasma treatment, does the virus strain of the donor need to match the virus strain of the recipient?
Yeah, so that's a great question. I think with COVID-19, it's kind of like you're dealing with one thing. So there's a lot of the people who develop antibodies and are successful at it, those antibodies would work against the new virus. It's actually a very good question. But in COVID-19, there isn't a lot of mutations that we know of so far. So if somebody got it, those fighting cells would likely, very much so, work in the person who doesn't have them yet.
Okay, so then you might have just answered this next question, but maybe not. So I'm going to ask, does having recovered from one strain confer immunity against another strain?
Yeah, so it's similar to some of the other questions that we asked, but it is a confusing topic because I think when people read the media, like some newspaper reports, you can do very, very fine analysis called phylogenetic analyses to really by one base pair, one little fragment of amino acids, distinguish one from the other. But from the body's perspective, it's the same thing. So you might read in a newspaper that New York had more of a Europe COVID-19 and the Bay Area had more of a Washington State or Chinese COVID-19. But it all is, to the body, it's the same COVID-19. That's why I think the vaccine would not be like super hard to do. It's not like the HIV vaccine where it's mutating all the time. This is kind of like one thing. The body sees it. Scientists will develop the vaccine to this one thing, and then we can move on with life.
Okay, another question that's popped up in the last few days and widely reported is that there's talk of strategic infection, of sending young, healthy people out there either into what would be considered sort of high-risk situations or purposely infecting them so that they could develop, right, the antibodies and then the immunity. And then when there are enough people with immunity out there in society, the idea is then you don't give it to each other anymore and you start to kill it and squash it. What do you think about that?
I'm very frightened of that for several reasons. First of all, the idea is not new. I mean, people have been doing chickenpox parties for a while, particularly people are a little bit nervous about giving vaccinations, but the risks are several-fold. First of all, there is no guarantee that the young person that you're putting out there to get COVID wouldn't get super sick. In fact, the biggest age group in San Francisco County of people who got super sick and were hospitalized with COVID-19 was a surprising age group. It was under age 40. So I think that there's no guarantee that person wouldn't get sick. And then secondly, if they didn't get sick, they can easily infect grandma or grandpa who would potentially get super sick and die.
Okay. All right, Dr. Chin Hong, thank you so much. We're going to take a short break on the air and continue our conversation on our live streams right now. Be right back. All right, folks, my mic is having some crackling right now, so we're going to change that out. This is how the sausage is made.
Yeah.
There we go. That one. Let's try a different one, see if that helps. I don't think it's a battery issue because I was charging it. I still hear it. I wonder if it's my devices. Could it be my phone? I could turn off my phone. Oh, that seemed to have taken care of it. Maybe that was the microphone. Okay, folks. Got a new microphone. We're good to go with Dr. Chin Hong. Okay, let's see if we can tackle a few more of our viewer questions here. Oh, Diane Nolasco, you noticed the static. Thank you. Yes, yes, we did see that. Lakhan Bosgrania wants to know, I don't have any symptoms at all, but I want to be around my grandmother. Should I be tested before doing that?
I think, in my personal view, testing should be plentiful, it should be free, and anybody should be able to get it anytime they want to. It's just that the reality of our situation is that we didn't have enough tests until recently where we were ramping up. So if you can't easily get a test depends on your hospital system or your healthcare system, I would say it's okay to hang around your grandma, but as long as you wear a mask or maintain social distance. And until then, unfortunately, there's no better way. A lot of people haven't seen their grandparents because of this reason.
No, this is true. I mean, I've done a drive-by, but that's about it, way from afar. But definitely, I realize the risk I carry because I'm still going into work, right?
Yes.
So, okay, coming back on air in 6 seconds. Thank you. All right, we are back with UCSF infectious disease specialist Dr. Peter Chin Hong to answer more of your questions. So, doctor, let's start with this from Monica McLawn. Wearing your face mask anytime doesn't matter that you have system, I think she means symptom, or not. Don't be childlike. Okay, well, you know, I think the face mask issue is one that a lot of people are still asking. Specifically, I've seen people asking about exercising. Sometimes people find it actually hard to breathe and get their oxygen in if they're wearing a mask. What do you think about that?
I mean, I think it's a tough thing. Even myself, when I want to go running, I worry about that too, because it's kind of difficult for me to breathe through a face mask. So I would say probably the easiest thing, and that's not easy for everyone, I understand, is to choose a time of day when there aren't a lot of people, or choose a place where there aren't a lot of people. And that might be difficult to find, but that's probably the best way to not wear the mask. Otherwise, you can imagine like a team, you know, a track high school team, although they're not supposed to be running in a group, say runs by you, you kind of get caught unawares and you're not wearing a mask. And that's kind of like a tough place to be. Again, running by somebody for a few seconds probably wouldn't make much of a difference in terms of risk. But again, you know, controlling your environment, I guess, is key.
Okay. Mona wants to know, will there need to be a vaccine before schools open again? Judgment call, but what do you think?
That's a great question, Mona. There wouldn't need to be a vaccine before schools open again, but schools as we know it, and some of the predictions about how schools will be once we open, they're very interesting. They're not going to be the schools that you recognize. There's been talk about going back to school in shifts. So there might be a Monday, Wednesday, Friday group and a Tuesday, Thursday, Saturday group. In that way, you can have half the number of kids so that you can maintain social distance in an easier fashion. That will probably also extend to the workplace for some workplaces where you can divide the day into two, and half the employees will go in one time of the day and the other part will go in the other time of the day, apart from doing like telework, etc.
Okay. Heather is asking, can you please explain the shaking with chills versus just the chills? Again, that refers to a new CDC symptom. Yeah.
So the chills are like, I go like, oh, I'm feeling like cold and my body's just trembling a little bit. The Riger's shaking is like, my bed is like moving. I'm going like that. And that is the difference. It's the same thing, just amplified. So it's really the same symptom. One is a little bit more severe than the other. But again, none of those are very specific. So they don't get included in my top two, which is fever and can I smell the coffee?
Teenager with diabetes type 1 stay away from grocery stores? A good question on behalf of folks with diabetes.
No, that's a great question about diabetes. I think we worried a lot, and we're still a little bit nervous about people with other medical problems. But I would say that the teen with diabetes, and diabetes is very common. So, you think about the risk of the situation. If the teen with diabetes, again, does all the things that we as a society is recommending, meaning if you go to the grocery store, make sure you wear a mask, wash your hands a lot, maybe wipe down that iPhone when you get home. But the main thing is protecting the nose and your mouth. I think it'll be fine, because again, it's only if you didn't protect your nose and your mouth and you went to that grocery store, that teen with diabetes would be at the risk. But if you're doing those things, it will be pretty safe.
All right, and here's a good question too, coming in from Philip Schwartz. Philip wants to know, I always get the flu shot each year. Should I get a flu shot early, and will the vaccine for this one be different?
Well, that's a great question. Very sophisticated question from the group today, Kristen. I think that usually some people strategize about the flu vaccine and they wait for a little bit later in the season with the idea that if this flu vaccine doesn't seem to be working, you can kind of get the later version of the vaccine. But I think with COVID-19 upon us, I probably wouldn't wait, because I would definitely want to protect myself against something, so at least I can empower my body to not get two things at the same time. Because again, the worry is that you get COVID plus flu,
right,
which would be much worse than just getting COVID alone.
Right. All right. So Dr. Chin Hong, definitely we should get our flu shots this year. Let's chat a few more minutes over on our live streams. We're going to take a short break on the air.
An important announcement from ABC7 KGO-TV. On Wednesday, April 29th, ABC7's digital frequency will change. If you watch ABC7 with an antenna, you need to mark your calendar and plan to rescan. On April 29th, grab your remote, go to the menu, select Setup, choose Antenna, and then Channel Scan or Auto-Tune. Your TV will do the rest. It's that easy. Make sure you can keep watching ABC7. Plan to rescan on April 29th.
Hopefully we can get to these two. I'm not sure if we can, but how much?
In commercial break, 2 minutes.
2 minutes. Okay, great. So John McBride wants to know if someone with COPD is more at risk with the virus than someone with just normal asthma.
Yes, we don't think there's much relationship with asthma so far and COVID-19, but COPD, a little higher risk with COVID-19.
Okay, good to know. How about swimming pools? Liz wants to know thoughts on opening swimming pools this summer. How risky is that environment?
I think the swimming pool is tough unless you have your own swimming pool or if it's a swimming pool for a few people. Of course, if they open the swimming pool in shifts and they control the number of people, it's one thought. But again, think about it. It's really tough to control kids in a swimming pool or even adults. So I'd worry a little bit about it. Social distance.
Yeah. All right. Vernon Marcada wants to know, would ibuprofen or other pain meds have an effect on your risk of getting the virus?
Yeah, that's a great question because the WHO gave a confusing recommendation a few weeks ago where they implicated ibuprofen as being bad. But so far the evidence, and they've reversed that recommendation, I must emphasize. So far there's no evidence that ibuprofen is any worse than Tylenol. In fact, I like ibuprofen myself. It's better for aches and pains. So I take it.
Okay, that's good to know because I'm just about out of Tylenol. Okay, we have 30 seconds. One last question. Diane wants to know, actually Roman wants to know, when do you think everybody will be able to get tested freely? Whew.
I think that's a dream I have every night, and then I wake up and pinch myself and remember that we're not in that fantasy land.
Yeah, all right. Unfortunately,
yeah.
We're out of time, so maybe you can get on our Facebook and answer that question. All right, thank you, Dr. Chin Hong. And we are back. Thanks for joining us once again. ABC7 is honoring our 2020 graduates because, you know, they've had to forego graduation ceremonies and other milestones due to the pandemic. So today we honor Jasmine Sorrells from San Francisco, graduating from Oberlin College. Jasmine double majored in psychology and law and society. She also played on Oberlin women's basketball team all 4 years. She even helped them win a championship. Jasmine's mom says she's extremely proud of her. As for what's next, Jasmine plans to apply to law school. Good luck, although you won't need it. Congratulations, Jasmine. If you want to honor a graduate in your life, share the details at abc7news.com. We may give them a shout out on TV or online. No professional photos, please. Check out a photo gallery of all the seniors we're honoring on our website, abc7news.com. Show Getting Answers will be here every day at 3 o'clock on air and on our live stream. Take care. Thank you, everybody, for watching. Woohoo! This one was a little challenging because we had a lot of moving pieces.